always with our providers. Behavioral health clinician, and we built up experience on mental health substance abuse at our location. And we really used a lot of training staff before we added them into the system. Kind of the things that we did well, too, is we kept the state and federal stakeholders informed. To be able to do this, we had to go back. We are a HRSA grantee, and we had to go back and ask for change of scope. And I know that scares a lot of community health centers, but it was really, we showed our project officer why we needed it, and it really isn't as scary as that people think it is. Indiana Medicaid allowed us to be able to change primary medical providers for these patients to HealthLink. This was an issue because Indiana had just, Medicaid had started a one-year lock-in. So some of these patients that we wanted to take care of at Porter Stark Services already had another provider. So they allowed us to do that. And a lot of this was keeping them informed of what we're doing. We have a very strong buy-in from top leadership at both organizations. We schedule weekly meetings, and we sit there and we talk about what we're going to be doing for the next week. Like when we have visitors, their first comment is, we don't know who is whose employee, and that was really what we were striving for, because we are one team with the patient in the center. We've also found that to get qualified staff in there, you've got to form the teams between the two organizations. And if you do that right, you really start to see the outcomes. We documented health needs and improvement, and here's just, with our group after about 2.5 months, here's some of the things we were monitoring: weight, waist circumference, cholesterol, triglycerides, smoking status, exercise, PHQ-9, CAGE, and GAD. And you can see as the health outcomes improved, so did the screenings that we were doing. So that was really promising, and we're continuing to monitor those. We realized we have to do a lot of education and training of both organizations, and that's from the front desk on, so that when we first started all this, especially at HealthLink, we had some problems where staff were saying, are you here for mental health or physical health? And we said, no, that's not acceptable. They're here for an appointment. We also have struggled to find some of the employees who were up for the challenge on both sides. This is not your typical mental health or primary care operations, and so we really had we had some false starts there too.